Hello, hello, everyone. As you're starting to come in from the Zoom waiting room, we're so excited to have you here today for our webinar. We'll get started in a few moments as we allow folks to join from their previous meetings. So go ahead and start getting settled. Grab a beverage if you have one near you so that you can stay hydrated for the next hour. And if you're interested, we would love to know who you are and where you're from. So feel free to introduce yourself and your role and institution in the chat as you feel obliged to. Okay, we have the first person, Kaylee from Boise State. Welcome. Oh, here they come. Oh, that's when it starts coming through and you can't keep track of everybody. Fantastic. So many different types of roles, institutions. I'm sure we have every time zone represented as well today. Okay. Wow, wow, wow. Continue to introduce yourselves in the chat. We can't wait to get to know each and every one of you. But let's go ahead and get started here. Welcome to our webinar today focused on collaborative crisis prevention on college campuses. Whether it's your first, third, 15th, or more mantra webinar, we are so glad to have you with us today. This webinar will last 1 hour and it's going to be structured as a panel with Q&A throughout. We have a few main questions prepared, but we will need input from the audience as well. So as you have questions throughout the panel today, place them in the Zoom Q&A as they come to you. And then we'll get to those throughout each topic area and definitely at the end. For all of those that registered or may not be able to make it or want to share this information or review it afterwards, there will be an event recording and that will be emailed out to all registrants following the event. This recording and all of our webinar recordings exist on the Mantra Online Mental Health Resource Database on our website. At the end of the panel today, we will have a post-event survey via Zoom as you exit. So please, please, please take 1 minute and fill that out as that helps us plan our future events. In fact, this webinar is part two of a webinar that we hosted back in the fall. And one of the recommendations was to have a specific webinar about this topic, about really infusing collaboration and addressing crisis early on campuses. And so that's a direct result of attendees' feedback. So to introduce myself, my name's Ethan Fields. I work on our partnerships and sales team here at Mantra Health. My background is in higher education student affairs, and I also have worked prior to Mantra at the JED Foundation, which is a national nonprofit focused on mental health and suicide prevention in schools and colleges and universities. And now I'm really excited to be here to introduce our incredible panelists, the folks that have joined and are going to provide us with all their expertise today. So starting first, I want to introduce Vic Armstrong. He's the VP of Health Equity and Engagement at the American Foundation for Suicide Prevention. He's a nationally recognized speaker on health equity and access to healthcare and how to leverage existing community resources to fill gaps in access to care. In his professional career spanning over 30 years, Vic has held many prestigious roles, including serving as North Carolina's inaugural Chief Health Equity Officer and the Director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services, as well as the Vice President of Behavioral Health with Atrium Health. Vic serves on the steering committee for the National Action Alliance for Suicide Prevention and is the board of directors for East Carolina University School of Social Work and of the Council Advisors of St. Augustine's Universities and RI International. He's a proud HBCU alum and now works with HBCUs to raise awareness for student mental health and suicide prevention efforts. So welcome, Vic. Our next panelist is Dr. Virginia Hardy. She's a distinguished leader, educator, and advocate with a profound commitment to fostering inclusion, excellence, and community well-being. She brings decades of experience in higher education leadership, having served in various transformative roles that underscore her dedication to creating equitable and thriving environments. For nearly 30 years, she served as the Vice Chancellor for Student Affairs at East Carolina University. Love the connections there between Vic and Virginia, where she led initiatives to enhance student engagement, promote holistic well-being, and cultivate a campus culture of belonging. Dr. Hardy championed strategic efforts to address the evolving needs of students while strengthening partnerships across the university and surrounding communities. So welcome, Virginia. Thank you for being here. And then we also have Dr. Adam Sargent, who's the director of the Counseling Center at Colorado State University Health Network and is an adjunct faculty member for the University of Colorado Anschutz School of Medicine. Adam is a licensed psychologist and has worked in college counseling for over 15 years and has helped design the post-hospitalization team specializing in assessing and treating students with suicidal behaviors at CSU. So thank you for coming back, Adam and Vic, and thank you for joining us, Virginia, on the panel today. Okay. So as we get started today, I did want to take a few moments to just acknowledge, given the political landscape that we found ourselves in, we know that this is a challenging time for students and campus leaders, and we want to acknowledge the fears that many of us may be experiencing, because we know that every campus and state is dealing with this in different ways. But at the heart of the matter, we know that every student is arriving on our campuses with a different variety of mental health concerns or even pre-existing mental health conditions, regardless of age, what program, what type of institution they're coming in, because we know that mental health is a continuum. And they also have their own unique backgrounds, experiences, and understanding of what mental health even is for them. So it's important to acknowledge this, because we're going to be encountering students with these challenges day to day, and we find that continually clarified in data like from the Center for Collegiate Mental Health that just released their latest annual survey of data from college counseling centers. And we also know that based on population level surveys like the Healthy Mind study that 60% of students are screening positive for at least one mental health condition, and that more than 3/4 of students have acknowledged that mental health challenges have impacted their academic performance in the past 4 weeks. So ultimately, as a community, there's going to be moments where one of us, maybe many of us, may actually be in a crisis or having to assist in a crisis. That's why we're gathered here today, to think through how we can address crisis early on and build a more responsive, collaborative safety net for our campus communities. So let's begin. The first question that I have for the panel today is, how can we relay the messaging that crisis prevention is everyone's responsibility on campus, that it's not just relegated to the counseling center or even to just student affairs, but that all of us, from pre-matriculation through the college experience and beyond, that it's a responsibility for each of us. Vic, would you like to kick us off?
Sure. I think one of the things is the way I always like to define crisis services and suicide prevention in particular. When I talk about suicide prevention, I always state the fact that suicide itself is not a disease. What it actually is the worst possible outcome of a combination of a lot of very complex things, often including mental health challenges. But what that means is, if it's a combination of a lot of different things, it means that there are often opportunities to intervene if we have the right resources at the right time when a person needs them in the communities where people live, work, play, and worship. That means that all of us can be instruments in providing that protective factor for students if we interact with them, if we're in their sphere. The other thing that I for folks to keep in mind is that when we think about someone who is experiencing a crisis or who's going through suicidal thinking or finds themselves at a place where they're overwhelmed emotionally, you may not necessarily be able to take that person out of that state of suicidal thinking with one conversation, but you can save a life with one conversation. You don't have to be an expert, you don't have to be a mental health expert. Oftentimes people are experiencing crisis or experiencing suicidal desperation. what they've lost is they've lost hope and they've lost social connection. You can provide both of those in an instant. So it is incumbent upon all of us to understand that we could be the instrument that provides hope or social connection to that person who's experiencing crisis. And that makes it all of our responsibility because we all have the ability to intervene. We all have the ability to help. And then the final thing I'll say is that when you're involved, when you're part of a college campus, you're part of that community. And as a part of that community, you have a responsibility to others in that community, whether you're a student, whether you're a faculty member, whatever your role is, you have a responsibility to make the community safe for everyone. And so it becomes everyone's responsibility on that campus, in that community, to make sure they keep one another safe.
Oh, thank you so much for that, Vic. Adam, do you have some thoughts from your experience at Colorado State?
Absolutely. Yeah, I would absolutely echo everything that Vic just shared. I think about how important community is. I think everything from our experiences and practice all the way to research backs up that community really can be the answer. On the inside of a college counseling center, I'd love to encourage folks, regardless of their particular station at a university, to think of championing the message of creating a culture of care on your institution, and that it doesn't have to just live with the counseling center or with the health services. Actually, I think that championing that message and spreading that around campus is really key. um, I think getting that in the hands of administrators and putting that up the chain, to sort of say, hey, it's not just the job of the counseling center, of the therapist that we've got on campus to champion mental health and to talk about suicide. I think it empowers people to realize that they play a role. I think the way Vic talks about it really demonstrates the power of just conversation, simple conversations, being able to save a life. I don't think people know that. I think it's an issue that can really scare and overwhelm people. But the higher up you are the administrative chain, the more I think it is important and imperative it is for you to spread the message of this is all of our work. We need to create this culture of care that spreads across the campus, into the classroom, and across all the different areas. I think that's really, really key. So I think connecting with people that can champion that message, be it administrators or deans or professors or whoever, and really get the word out that it's all of our issue. I think that that can do an awful lot of good. We watched that message really spread kind of like wildfire at CSU, and I've been to so many spaces and places that are outside of the mental health world where I hear people say, hey, this isn't just a counseling center issue, this is all our issues, and that puts a big smile on my face when I hear that.
No, that's great. What about from your side, Virginia?
Sure. So, as a licensed professional counselor, I always believe that it is important that this is for everyone, right? Everybody's responsible, as Vic said earlier. Everyone's responsible for taking care of our students, for their well-being, for their education, for their development, and the mental wellness of our students is no different. So it is all of our responsibility. And if we think about this as a multifaceted approach, then having our faculty and staff members who are on the front lines, who see these students on a daily basis and touch their lives in so many ways, having those individuals, faculty and staff, to play a crucial role in being able to recognize signs of distress, creating and fostering a supportive environment, and helping students to connect not only to the resources that are on campus, but to each other, I think plays a major part in students feeling like they have a sense of belonging. And that helps to normalize a bit too, right? Because it's very, if we're all talking about it, it normalizes those feelings and what students are experiencing, so they don't think they have to hide it away. They can go to Professor X or staff member X and have some conversations, and that those faculty and staff members feel comfortable with listening, providing whatever resources they can, and help directing those students to where they need to go, is definitely something that will help our students and help with the collaboration that we're talking about. It is, if we think about retention as everybody's responsibility on campus, then part of that retention is for students to be well, because if they're not well psychologically, physically, spiritually, etc., they can't be successful. So that makes it all of our responsibilities.
Absolutely. I'm curious from your all's perspectives, is there any specific type of messaging that you've seen worked? Because we talk about a culture of caring. What does your institution, or have you seen any institutions use any specific language? And if you had the experience, how did you get that ball rolling up to make that, maybe it is like CSU Cares, or I even think about some of AFSP's incredible campaigns and trainings like Talk Saves Lives, Seize the Awkward, all of that messaging. So I'm curious if anybody has any feedback on that.
Yeah, I will say one of the things that I think we have been mindful of at AFSP, and I think it's especially important to have this aspect of the conversation now. What we have seen is that um, whatever resources we design for communities, they need to be culturally relevant and relatable to the lived experience of the individuals that we're trying to reach. And so what we have found is that when we can create resources that people can see themselves in, and there are resources that are not only resources that provide access to more of the same resources that we've always provided, but resources that are relatable, that do relate to that person's lived experience, but also resources that a person's willing to utilize. And what we found is that if we can identify places where people are already convening, either on a campus or in a community, and rep resources around those already trusted spaces and trusted messengers and safe spaces and safe messengers, that has worked best. And that's one of the things that we've done with, we've created for my Talk Saves Lives, which is kind of our signature suicide prevention program. We created Let's Save Lives, which is an acronym for Listening, Empathy, Trust, and Support Saves Lives. But it was designed specifically for and by the Black community. We have Talk Saves Lives for Hispanic communities. It's designed specifically for the Hispanic community. So what we found is that messaging that people can actually hear and see themselves in, and when you create resources that the imagery looks like the communities you're trying to reach, we found that kind of messaging is the most effective. If you provide resources in the community that I am not willing to utilize, either because I don't trust them, because I don't understand them, or because I don't see myself in them, you have not given me resources or given me access to resources that benefit me. All you've done is given yourself access to me, which is not helpful. And so any kind of messaging I think that we can create where people can identify with it, and it doesn't have to be overly complicated. It can be as simple as, like when you talk about, when you mention Talk Saves Lives, it's a very simple thought, but that's the idea. Talk saves lives. If we open up and talk about it. So keeping messaging simple, keeping messaging to the point where people can see themselves in it and where people can identify with it, I think are the most important things. And that's what we've seen the most success.
And I would add to that, the language, the messaging also being accurate, right? Just to say, I think we did something at East Carolina around, this is real, right? So that yes, what we're going through is a real thing, and it's okay that I'm experiencing what I'm experiencing, and I've got peers and others who can help me through it. I think is also a very important. So it's peer talking to peer. The other thing I think is important is for our faculty members and our staff members to have language as well. At one point, we did work with our academic colleagues at East Carolina, where faculty members in certain departments or certain schools and colleges were actually adding information onto their syllabi. So you would put information there that students would, because students are reading, right? They're going to read the syllabus. And so there was language there that was inviting, welcoming, and supportive. And so students knew that if nothing else, I got this professor because that's what he or she has put on the syllabus, and I can go to this person. And so that was helpful as well. And there was some collaboration on what that language was going to be, so that it was going to meet people where they were and be inviting and welcoming.
Yeah, I agree with everything that's been shared. The other thing that was coming to mind, kind of riffing off that idea of keeping it really simple, is it reminds me how anytime that I'll give a talk around this, everybody's head will nod. Like, people agree with this message. It's not a hard message to understand. And those exact same people, a lot of times when faced with a real student who's in distress, their frontal lobe falls out. in that moment, right? Like it's so easy to blank out or to feel scared or to feel overwhelmed, which makes sense. The stakes are high. You don't want to do any harm. Um, and so, in addition to, I think, really key, simple messaging, I would encourage two things. And one is trainings, and the other one is some infrastructure. So, trainings can be very, very simple. At CSU, we've used the Notice and Respond program. And just it sounds similar in the sense of just you notice something, you do something. Uh, but what is the do something? A lot of times, like I said, we don't have our frontal lobe right in that moment if we're sort of feeling panicked or overwhelmed or on the spot. Um, so I think resources, and that usually looks like some infrastructure built in, whether that's a line that folks can call no matter what the issue, where they can get somebody else's frontal lobe to pair up with theirs and support them. Um, Websites where materials can be gathered sort of as a one-stop shop for people. I think that big communities and big institutions especially need to be really savvy about the fact that we're talking about hundreds or thousands of people that have varying degrees of comfort, training, experience, whatever. um, I learned as a young clinician, the more I got comfortable with asking about thoughts of death and suicide and that sort of thing, the more often I heard yes, which was sort of a sad realization to earlier in my career, that meant that I wasn't getting deep into that conversation and getting the truth because of my own discomfort. So I think practice is really important. So doing trainings really, really matters, but also having some support and infrastructure um, for people when they might not be at their best or when they might be overwhelmed.
Yeah, that's a great point. Um, and what I'm curious is what are ways that you've broken in, like gone beyond the silos of campus departments to get that buy-in, to get the faculty member to put something on their syllabi, to adopt a program like from AFSP, or to even be asked to present your own mental health training program. How did you break in there? What are some strategies for those that are still struggling to get that buy-in?
Well, one of the things that we've had some successes, and we're still kind of early in this process, is in trying to engage both HBCUs and minority serving institutions. And what we have found in trying to engage those campuses is that oftentimes you're talking about a community that has not had this conversation before, at least not collectively and not openly. And so there is some reluctance to have the conversation. And so really listening to what some of the concerns and the fears are of the administrators, of the faculty, and of the students, and try to engage in those conversations, and then find out what ways they're willing to engage, where they're willing to start. I had a conversation, for example, with an HBCU last school year, and I was having a conversation with them about coming in and doing some programming around crisis and suicide prevention. And their position was, we don't think we want to start there. We're not. They initially just said no. Then they said, well, our hesitancy is we've never had any mental health conversation on the campus. And so to start with suicide and crisis, we feel like may send the wrong message that there's some kind of panic on the campus. And so then the conversation shifted to, well, where can we start? And it started with having a panel on the campus, and having a student sit on that panel and having a professor sit on that panel. And I ended up moderating the panel, but we made sure that we had people on the panel that the audience was comfortable with, that the university was comfortable with, and that we were very clear with them, and this is where we're going to start the conversation, but then where can we go from there? So from there, we've had other conversations, we've built other things into their program on the campus, but it all started with really understanding where that campus was and where they were comfortable with starting, and not trying to push them beyond that space, but recognizing that whether you're talking about a campus or an individual, you have to start where they are, and you have to engage with them where they are.
Yeah, we in understanding where people are and where they were at this stage, we were providing information, statistics. Here's the reality of what our campus is. We were doing that at faculty senate meetings and sharing that information. And the faculty, of course, were experiencing it on a daily basis in their classrooms. And so the numbers might have been shocking to them, but the information was not. What we were asking of them was, here's the reality of it. Here's how we want you to help us. What we learned was there was a fear and there was a concern from faculty of what's the liability if I do ABC and something doesn't work out right, and what's going to be for me. And so we had to address their real fears from both a legal and a risk perspective, but also then providing them with some tools that they could use to be able to help their students better. One of the things that came out of that was a program that is still in play today called HOIST. HOIST, which stands for helping our students thrive to thrive. And so it's a partnership with the Division of Student Affairs and started out with the Office of Faculty Development, and where they would come together and actually decide what are some of the topics that faculty want to hear. And it's kind of like a brown bag, like a journal club type thing. Bring your lunch, bring your whatever, and here are the topics. We're talking about mental health, we're talking about disability, we're talking about plagiarism, fill in the blank. But that gave folks an opportunity in a small, informal setting to really learn some things and to gain some skills and knowledge and awareness that they could then take back to their fellow faculty members and also use in their classrooms. So that program is still going on, and being able to work with both student affairs and our academic colleagues at the university.
Another angle I was thinking of in response to your question, Ethan, was a lot of the success that we've had at CSU has been making sure that we're communicating up everywhere we go. So when I go, if I'm coming and representing the counseling center, and I'm talking to somebody that's, maybe more into administration or they're more into budgeting or whatever, I try really, really hard to speak their language or to think about what might gain traction. And so I think there's really good resources out there. You had mentioned earlier CCMH, that's a good one, ACHA, AUCCCD. Some of the data and white papers that come out can be really, really helpful, talking about how the more you invest in some of this infrastructure, the better it is for ROI. And that's not something that typically a mental health person is going to think about. They might not think about the dollars and cents. They might just think about it as the right thing to do. And it's important to be strategic to show that these programs can help with student retention, help with student success. And so I know lots of people in the mental health industry joke about us not, we didn't get math degrees for a reason and that sort of thing. And I think leaning on the tools that we have to sometimes talk dollars and cents. For example, the post-hospitalization program that we have here has been running since around 2012. And we just did a presentation on folks continuing to graduation, so persistence to graduation numbers for people that are in that program. And that was really important for us to be able to say, hey, 96% of people that get connected to this program persists to graduate here. And that's a really big deal because it's a resource intensive program. And this is a group of folks that have had suicide attempts and have gone to the hospital and have came back and not only stayed connected to the university, but they've gotten wraparound care and services. And without resources like that, I think that recent CCMH paper that you're talking about goes into some of the details that like those folks typically are going to struggle more, and their outcomes won't be nearly as good psychologically, but also academically. So sometimes resources of intensive programs can really pay off. And I think that, being able to speak that language depending on where you're positioned in your university is really, really important.
One thing I would add too, Ethan, is, I always come back to that a college campus is a community. And so we think about accessing a college campus the same way we would think about getting access to a community. And there are a lot of different ways to engage a community, a lot of starting points to engage a community. And so oftentimes when we think about how to engage college campuses, we come in with a very programmatic approach. But communities are more relational than they are transactional. And so sometimes I think where we can start is thinking about where can we build relationships with different aspects of the community. For example, we have a partnership with Omega Psi Phi fraternity. And so we utilize that partnership because they have access to students on campus. And oftentimes it's easier for students to bring a program to campus than it is to go through administrators to bring a program to campus. So you think about those kinds of things. One of the other things that we did is we have a program called Soul Shop for Black Churches, which teaches faith leaders how to minister to congregants that are experiencing suicidal desperation. Well, we partnered with Blue Cross Blue Shield North Carolina and Shaw Divinity School to train faith leaders in their divinity program in this Soul Shop program because they access the students and families. And so again, it's building that relationship so that when we come to those campuses with other resources, and especially with crisis resources, remembering always that when people are experiencing crisis, when they're at their lowest point, when they feel like they don't have any place else to go, what they're looking for is familiarity. They're looking for safety. They're looking for connection. And so the better we're able to build those relationships and have those pockets of people on the campuses that are familiar and that are safe spaces for those students and faculty, the more likely they're going to be to turn to those resources when they find themselves in crisis. When you're in crisis, that's not the time that you say, let me go find somebody different from me that I don't know and see what they have to say about this. No, you're looking for connectivity, you're looking for safety, and you're looking for familiarity. And so the more that we can build those relationships ahead of time, it makes it easier then to build upon those programs that want to bring onto the campus.
And one of the communities I think we don't use as much in that regard, and it's because we want to protect them, are the students themselves, right? But sometimes the students are more than willing to share their stories and be a resource to, again, normalizing, but serving like, if it happened to me and I made it through, you too can. Or, creating those support groups that are outside of the counseling office, but they're support groups that can help them, using them as well when they are ready to be a part of the solutions.
Those are great points. And as you were thinking about different populations, and this relates to the question I really wanted to ask, like, what should we be training faculty, staff, and students about, mental health and crisis? But there's a couple of other student populations that folks reached out to me prior to the webinar about and have already started asking in the Q&A. And my first is about online students, because again, it's about building relationships. What are some, if you've seen any successful, whether it's trainings around recognizing an online student at risk, and how do we train faculty, staff to respond differently or specifically to those students?
I think that is a tougher one, right? When we look at doing that from a career services lens is different. And I say that because when I was the VCSA, we were able to do that much easier. Um, um, there are still signs that individuals are going to present, right, online that as you would in person, which would be, absenteeism, moodiness, those various things that we would say to you in person to help our faculty to look for. And then the campus, the university itself has to make sure that they have there are those resources for students, whether it is an external vendor who's doing that, or if the university is providing some online services from their own counseling center, and so that faculty still know how to make that referral to if it's an online site or internally. So I think the process is still going to be the same as long as the resources are still available, because some campuses may or may not offer online services, right? Or after hours or late night, it's best for me. We think about professional students. I worked at the medical school, and medical students are not going to be able to go see a counselor between 8 and 5. Their schedules won't allow it. And so what do we have for those professional students or our student athletes for after 5? Type thing, and how do we still make sure that they have some services? That's where modifying the counselor's hours, having an external consulting counseling service available for folks to be able to provide that. We have to really think about this as who these folks are, right? In the sense of the new generation of students, how they probably want to get some of their services anyway online, and then make sure we have something to give them. But I think some of the signs and symptoms may be the very same that we would see in person.
Yeah, one of the things that we offer as well as an interactive screening program, which is an online tool for college and university counseling centers to reach out to students that may have barriers around help seeking, fear, embarrassment, things like that. So we provide those resources that can be available whenever people need them. We also have a documentary, it's an 18-minute documentary called "It's Real: College Students and Mental Health." And so we have those things available, and we have them available electronically so that they're accessible not just to students but also to faculty. And I think, again, having those kind of resources where people in their own space can reach out and as they're comfortable can access those resources. We also always share with folks that 988, 3-digit 988 is available. And so whether students are on campus or not, if there are folks that are struggling anytime, they can dial 988 and speak to a counselor who can connect them with resources. And so making students aware that those resources are out there, whether you're on campus or not, you're part of this campus community, I think is extremely important.
Absolutely. The other population that I was getting questions about was around international students, both whether it's about a training or doing some mental health education with that population, but also how do you partner and bring that knowledge to that specific area for faculty and staff as well? Do any of y'all had any experience with working with international students?
Yeah, one of the key programs that we've maintained at the Health Network here at Colorado State has had a strong liaisonship to our international programs, which means that we don't have necessarily like a full-time clinician embedded. Um, we do for certain populations, but we have somebody that can show up to meetings and spaces and sort of meet those students where they're already congregating versus expecting them to come over for services. So I think things that can build a relationship, I think, is key to a program to be successful, to make sure you're staying connected and also having some staff that get what might be the sort of unique challenges, fears, et cetera. That population, I think, is really, really key. Um, we've done um, lots of groups and workshops where we position ourselves over at international services so that we can connect with those students.
Fantastic. So as we're thinking about, again, these trainings for faculty and staff, and some of the essential components. We talked about them throughout different answers today, about what some of the critical components are, but are there any other great examples that you found that works well? I know that we had a question from someone about compassion fatigue. So also about how do we not only train them on the crisis prevention and response, but also what does the postvention look like for the faculty and staff that are having these conversations? So I'm curious if anybody has any thoughts around that.
Yeah, this whole notion of well-being, we think through the lens of the students, right? But counselors also get what's the word, burnout. And so the notion of compassion fatigue is also real. I think that's when there has to be some structured opportunities for not just the faculty, but again, all of those individuals who are working with students to have and some there is a university, or I know of universities that have what are they called, well-being days or wellness days, where that are baked into their calendar, and for folks can have that time away from each other to take care of themselves. I personally like that. Not every university can incorporate that into their academic calendars. But I think there's some value in that. So that what it's saying is, it's been a hard semester so far. Go take your day or two and regroup. But I don't know that I don't know of as many programs. I know I wasn't involved in many programs that did that address the fatigue that providers have.
I had a few things come to mind, and they come from different sort of facets of the university, but I think it's really important to have a robust employee assistance program. And I think to have those lines clearly drawn between, this is a counseling center that's funded by, say, student fees that's for students. It's really hard to sort of blend that work and to be like, and we also support the mental health of faculty and staff. So I think it's important, if it's true that the services that you have are all student focused, to make sure that there's services that are built in for faculty and staff too, so that they can get support, whether that be referrals to community providers or something that's done in-house. The other thing that I was thinking about is, as part of training, it's like going in and doing something like a notice and respond training that might be designed for faculty and staff. Part of the messaging needs to be around this very question, to describe and discuss and process a little bit of the fact that this work can come with some fatigue. It never feels comfortable necessarily to talk about. It's always hard. It's always awkward. Even when you're a professional, it can still be stressful. You can still walk away with questions. When we consult with each other inside of the counseling center, I'm sure a lot of people can relate to this. We still say, hey, here's what's still sticking with me, or here's what I wonder if I should have said or done. And I think just normalizing that there's not a perfect right way, but to do something. And again, I go back to what I mentioned earlier of having some system or infrastructure, be it like a line people can call where they can connect with somebody else. Because I think it's unrealistic to expect everybody to have expertise. I think it's perfectly realistic to ask and insist that everybody do something. And that something can be really, really different. But when we can have good communities that are connected by systems, I think that that's really, really important. Earlier, you were also asking about how to get folks to say, put messaging on their syllabi and things like that. I think that that's beautiful, to make sure that resources are widely distributed and to show that systems are connected across the university. And again, I go back to like the higher you are up the administrative chain, you might be able to insist that that's just a standard, that everybody has it across their platform on their syllabi or that sort of thing, so that you're not just asking people to voluntarily opt in. Because a lot of the people that would think ahead to voluntarily opt in are the people that are already having these conversations, that already have probably some good relational expertise. And so I think folks in positions of power should, really consider making some of this stuff less optional and more sort of like a standard that's just accepted across the institution.
Yeah, I also think, one of the things to keep in mind, I think, especially for faculty and administrators, students, at least large numbers of students will live on campus or be closely connected to the campus, whereas faculty administrators, they live in the larger community. So they're part of a larger community. And so what we don't want them to feel like is you can only relate to and access resources that are provided by your campus. There are resources in the community, there are national resources. There are groups out there that really speak to compassion fatigue. There are support groups out there for professionals who are experiencing compassion fatigue. So I think it's also important for universities to encourage their faculty and staff to access those resources that are available out there, and not to create stigma or shame around accessing those resources, but to encourage them to access those resources.
That's great. And as I'm looking at some of the questions from the audience, there's kind of a two-part here at each ends of the spectrum. One is, beyond just speaking about like trainings, for that practitioner, that person that's working with a student in the moment, do you all have any recommended de-escalation techniques or ways to support them in that moment? And then after we do that, the other end is for those when a crisis does happen, like a hospitalization. Can we speak a little bit more about the post-hospitalization planning? What is maybe some work that you may have done with like mobile crisis units, whether you've created them on campus or through community partnerships? So let's begin with the in the moment, and then let's go to the other end. Whoever would like to begin.
Well, I think to me, some of the basics of in the moment is, number one, if you suspect that a student is in crisis, or they identify themselves as being in crisis, you want to talk to them by themselves if possible. You don't want to talk to them in a crowd. You want to give them an opportunity to express what's going on with them. It's not always, I tell people all the time, it's not as important that you know the exact words to say as it is for you to create space for them to share the words they want to share. So allow them to talk about what's going on with them. And if they're in crisis, give them space to talk about what their crisis is. If you think they're suicidal, you want to give them space to talk about this. How does suicide become an option for you? Do you have a plan for how you do this? And then you're clear on how to connect them with the resources that can help them. But I think that the things that are the pitfalls we want to avoid are feeling like you need to solve this person's problem for them, that you want to give them quick advice, you want to solve their issue, because oftentimes what's presenting in front of you is not the issue. It may be unresolved trauma that's brought them to this point, and all you see is this breakup with the boyfriend or girlfriend, and you want to address that, but you don't understand there's unresolved trauma. So give them opportunity to talk about what's going on, and then try to connect them with resources. There's an acronym that we use in one of our trainings. It's called CALL, and C is actually commit to, and that's really more for you. Commit to, if you're in trouble, that you're going to reach out to somebody if you get help. That puts you in a help-seeking mindset, in a helping mindset for someone else who may be experiencing. Ask. Don't be afraid to ask if someone is thinking about killing themselves. If they're at that point of crisis, don't be afraid to engage in that conversation. Listen. Actively listen to them to hear what they want to share, and then lead them to safety and leave them in good hands. And so if you can do those things, I think you can help a person get through that crisis. But it's important to remember, again, you're not trying to solve the crisis. I tell people all the time, if someone comes to you and they're suicidal, what leading them to safety looks like to me is I either get them to a point where they no longer have a desire to die, or they no longer have the ability to kill themselves. So if the person can't come to a place where they have resolved whatever their crisis is, and oftentimes they're not going to be able to do that, at least get them access to the resources, get them in a place to keep them safe. And so that would be my advice for someone who's dealing with someone in the moment who may be experiencing crisis.
And the only thing I would add to that beautiful, beautiful answer and response that Vic just gave is stressing not to minimize what the person is experiencing, right? If it is they're presenting as it's a breakup, that you don't talk about, oh, it's okay, another one's coming, that kind of thing, but just to allow that person to say what he or she needs to say at that moment. And critical is making sure that you lead the person to the resource, right? Listen and lead the person to the resource.
Yeah, I love everything that's been shared. When I would do lectures to counselors that were just getting started out on suicide assessment, for example, one of the things that I remember us talking about a lot is that there is no research that there's some golden magic phrase that does the right thing. And so what I would have um, the students in the class do is practice how you would ask. You know, I know how I ask, but I'm a clinician, so I get to ask kind of the clinical way of, any thoughts of death or suicide you're currently experiencing or something like that. But that might taste weird in your mouth, and so it depends on your role and your relationship and your culture and your background and so many variables that there's not a right way to ask. I think it's important that we ask when we're worried and concerned. And I would always start out by asking people, have you heard that asking about it could make somebody more likely to do it? And over the last 10 years, I don't have a lot of people raise their hands anymore. So I think that we've done a good job, I think, of busting that myth. Was what that taught me, is that people had heard that you should ask, or that it's not going to make people worse. I think that thankfully that myth is largely dying out, which is really great. But when I ask people to actually practice, say the words out loud, they would nod their head like, "Oh, this is easy. I know I can do it." And I'd say, "Okay, go ahead, say it." And they would choke on those words a little bit, and it would surprise them at how hard it was sometimes to say words that felt invasive or uncomfortable. So I practice, practice, practice is what um, what I would say. Exposure therapy.
Thank you so much for that. And so on the other end of this, if a crisis happens, we have to escalate to a more high acuity type of response. Do you all have any recommendations or strategies for after that happens? And also to the question about either working with mobile crisis units and building those to facilitate a different type of experience for a student that does need that higher level of care.
Yeah, I feel really strongly about this one, and I think that institutions need to have really clear policies, particularly if we're talking about within a counseling center or outside of a counseling center. So if we're talking about treatment proper, I think knowing exactly what your policies are in terms of who you contact, what the thresholds are, what paperwork you fill out, who your support people are, those sorts of policies. It's important that that's really clear and that folks are trained on this upon hire and annually thereafter, that everybody's really on the same page about that. I think that what I've learned, we run a really large training program here, and so we get to see people going through that for their very first time, connecting with a student that they're concerned about, for example. And it's a very empowering experience for them, where they feel a couple inches taller after they get out on the other side of that as a professional, because the process is so clear and there's so much support and structure in place to help them through it. Some of the support and structure that I'm referring to is knowing what to ask, how to document it. Um, so having some of that sort of in place, and then having procedures of who do you contact. And you mentioned a sort of a mobile crisis team. I know some institutions build those in house. We're lucky to have some community partners that have a mobile crisis team. For those that don't have either, and you're partnering perhaps with police department or that sort of thing, if you can do any work towards building a co-responder program where there's a mental health professional that accompanies officers that might be involved in transports or that sort of thing. We've had a lot of success with both over the years. So we have lots of, it's back to community and relationship building even here when it comes to building some of the structure. We have really good relationships with our community partners that have access to transport or hospitals, that sort of thing. We meet with them regularly. We try to teach out of here's what's unique about a student situation and a student transport. And then I think it's really critical. I, I really like people to wrap their minds around, even if somebody's hospitalized, let's say, involuntarily, it's likely going to be a few days, 72-hour hold is what's typical here anyway. And then what? That seems like this peak pinnacle of crisis. And then what? And so I think the and then what is really key and critical to think about too. That person's going to get discharged in a few days. If you were their treatment provider, you probably already weren't going to see them for another week or two. Like they're going to be in, say, a hospital setting, get a little bit of treatment, and then be discharged back to your care in a matter of days. And so I think that then what is pretty huge. What we've done at CSU is we have a large student case management office that's separate from the counseling center. The beauty of that is that they get to exercise outside of HIPAA because they'll fall under FERPA. So they can go out to the hospital, connect with the student. They can then refer the student over to us. We can do an intake post hospitalization, get them plugged into a program. What we've settled on is a DBT informed program that has individual counseling, group therapy, psychiatry services, kind of some wraparound care where we get to see them a little bit more frequently. And that way, those counselors have a treatment team of people that they can also rely on and get some support from for burnout prevention and that sort of thing. There's also a centralized team of folks on campus. A lot of schools have, say, like a BIT team or a care team or a student consult team. Those can be really key as well, so that students can um, be sort of referred once that team has been notified that something's going on. It can be sort of like a central communications hub to get all those players connected.
Thank you, Adam. I'm being mindful of time, and what I've done is like weave all some of the questions from the audience and pre-event to really get us to our last question. And what we can end this time together with is how do we continue to empower ourselves and our faculty and staff members that are in this work together and other community members, right, to continue with this work day to day. So what are some recommendations you have for the audience around continuing to empower others and themselves in this work?
I think that the operative word there was themselves. I think if we can envision ourselves as being willing to seek help and being willing to acknowledge that, there may come a time where I need to talk to someone about my own challenges, that it's okay for me to have those conversations. It is much easier for me then to give someone else grace when they have to experience the same thing. I think we're closer to that. I know, Adam had talked earlier about how we've evolved now. And I'm thinking around the question about whether or not we make someone suicidal by asking the question. I think we've evolved in terms of being willing to acknowledge that we're all closer to the mental health continuum than we thought we were, at least than we thought we were pre-COVID. And so I think we're at a place now where we can have those conversations. And so I encourage everyone, start with yourself. Acknowledge that we all have struggles, we all have challenges. And again, if I can give myself grace to have those challenges, then I can extend that grace to others to have those challenges.
I also think that it is important that we remember that when the students are bringing their whole selves to our campuses, but those whole selves have been started forming prior to arrival on our campuses. So how do we begin having conversations with some of our K-12 entities, right? That and strengthen some of the resources and things that happen in K-12 as we lead those students to our campuses, and so that there is a partnership again within the community across that entire spectrum. So I think that's going to be important. As we think about empowering and informing our faculty and staff, how do we do, is there a way to do that on as we onboard new people? Right? Yes, the people we have, but as we're bringing in new people, how do we help those individuals to know that it is to your responsibility, and here's how you can help, and providing them with some of those tools and skills on the front end so that it starts day one.
Yeah, I was thinking about how do I stay sort of fresh and alive and connected, and one of the things that's really helped me is going to conferences, attending webinars just like this one, staying connected to national organizations, reading what's out there in journal articles. Like it's sort of nerdy community. It's community at its finest, just nerd version. You know what I mean? Of like my profession and what I get excited about. Because things get stale, I think, when you don't do that, when you're in your own circle or your own bubble, in your own silo, whatever. I think seeking community at your home shop is good to do too. And I think when you can get inspired and see what other people are doing, meeting other people, then you come back with sort of fresh eyes and it can renew and refresh what might have felt stale before.
Fantastic. I just want to thank each of you for being here today, from the panelists to the attendees to all the incredible questions, even those that we may not have had time to answer today. Again, this is part of this is a second part to a webinar. I know that we're probably going to have another one, I think focused on postvention coming up. Our next webinar is focused on coaching. So check that out on our website and register for that. We will also, if you have outstanding questions, please reach out to us at Mantra and we can get some answers from our incredible panelists and write up some ourselves. If you're interested in learning more about how Mantra fits into an ecosystem of care and plugs in at all levels of a care continuum, please let us know because we can extend and expand upon your campus safety nets. But just more than anything, thank you all for everything that you are doing to change and save lives each day on your campus communities, in your broader communities. And we can't wait to have you back with us again. Please take the survey as you exit the room, the virtual room today, to let us know how it went and any feedback or additional questions. And just thank you, Adam, Virginia, Vic, for being here with us today. All right. Thank you all so very much. Have a great rest of your day and weekend.